Welcome to Health and Wellness. I'm Will, nurse practitioner, and today we're going to be talking about 6 tips for new nurse practitioners. So if you're a new nurse practitioner or if you're about to graduate, be sure to stay tuned. Listen, being a new nurse practitioner can be daunting. Suddenly, you're the one making the big decisions. Your patients' lives are literally on the line. Now, I am by far no expert nurse practitioner, but I do think I have some valuable tips to share which helped me when I began my journey as a nurse practitioner. Be sure to watch this whole video because at the end, I have some special resources that I want to share with you guys. Tip number 1 is to use Uptodate religiously. If you don't know what Uptodate is, I don't know how you made it through your NP program. This medical reference database is the gold standard for finding up-to-date, medically accurate information for providers. While I'm working, I quickly reference drug dosing or renal dosing considerations. On the spot, the algorithms are super helpful. Suddenly you know what to do for your patient who has hyponatremia of unknown etiology. There really is so much useful information in Uptodate. Make a habit of researching on Uptodate cases that you saw during the day that you didn't feel 100% comfortable with. Now, Uptodate is expensive, but most hospitals and many universities will offer this service free for their employees and students. If you create an account, all you have to do is log into the service every 3 months on the hospital's Wi-Fi. Then you can use it on your computer or you can download the easy-to-use app on your phone. One free resource that I definitely want to mention is Medscape because that has great information as well. Tip number 2 is to make and use templates. As a new nurse practitioner, you're going to be overwhelmed whether you're in the hospital or the clinic setting. You're going to forget to ask basic questions to the patient and you're going to feel really dumb sometimes. You'll likely lack some confidence during the history and physical, and this can kind of mess with the way you remember things. This is why templates are super important in being your backup. Find templates such as history and physical templates and use them all the time. This will make sure that you don't forget to ask basic questions that you can't miss, such as their surgical history or their allergies or even their smoking status. If you can't find a template that you love, make one yourself. And speaking of templates, at the end of this video, I'm gonna show you how you can get some of the templates that I've made for free. So keep watching. Tip number 3 is to master verbal report. Now, I'm not talking about the nurse-to-nurse report. I'm talking about a nurse-to-provider or nurse practitioner-to-provider report. As an NP, you're going to be communicating with physicians and specialties, and they're used to hearing report in a certain way. This is why mastering verbal report is essential. Physicians are trained to hear report in a very specific S-bar kind of way. Unfortunately, they can get a bit testy if you don't give them the information that they're looking for in a concise manner. So the idea is to be concise, quick to the point, but also include all the important necessary information. In general, start with their age, sex, relevant past medical history, admission diagnosis, relevant findings, and physical assessment, as well as any recommendations. Since I work in the hospital, a quick, concise report that I would give would sound like this. The patient is an 86-year-old female with a past medical history of high blood pressure, high cholesterol, type 2 diabetes, and COPD, presenting with cellulitis of the right lower extremity calcaneal wound. Initial x-ray did not indicate osteomyelitis, MRI is pending. White blood cells are 13, lactic is normal, blood cultures are pending. Patient was started on Zosyn and vancomycin in the ED. After you present the basic rundown of this information, you can then tailor it to the person you're calling. So if you're calling a nephrologist, you want to specifically talk about their renal function, why you're calling, do they need dialysis, etc. I am planning on releasing a video later this month on giving a report, and so be on the lookout for that. Tip number 4 is to make and use cheat sheets. Now these are different than templates. Templates are what you use while you're talking to the patient, filling it out. Cheat sheets are what you use for diagnoses. So when I started as a new nurse practitioner in the hospital, I thought of the top 20 diagnoses that I would run into and have to admit. I sat down and made a cheat sheet for each diagnosis. Basically an overview of a couple up-to-date articles on the topic, including the etiology, causes, physical assessment findings, diagnostics, and management. Personally, the cheat sheets that I made on acute kidney injury and hyponatremia were invaluable to me as a new nurse practitioner in the hospital. Tip number 5 is to follow up on notes. Whether you work inpatient or outpatient, there's always going to be notes for you to read that you can learn so much from. Whether that's an attending physician, a specialist consultation, or even medical residents, you can learn so much from these notes. Simply following the paper trail and reading up on your patients after you've seen them can really help expand your knowledge. Tip number 6 is to have the right attitude. As a new nurse practitioner, you're the new kid on the block. You need to be humble, ready to learn, hardworking, confident, but willing to accept when you're wrong. Trust your instincts, but check your ego at the door. We're dealing with patients' lives here, and nothing is more important than hard work, communication, and collaboration with our patients and our colleagues. Something that I put a lot of work into that I think you'll find useful is my NP resource library. To get access, all you have to do is sign up below to my email list, and I'll send you a link to the folder. In the folder, there's templates for both inpatient and outpatient history and physicals, SOAP notes, and a death pronouncement template, and all you have to do is sign up with your email below. As always, please subscribe if you like this content. Check out my blog and my social medias, guys. My Instagram and Twitter follow counts are embarrassing. All right, that's all I got for today's video, so get out there and save some lives.